I had neuropathy in my feet and in my hands. I had pains that would come into my legs. My hands would go numb. And like I ride a motorcycle, and sometimes it'd take both hands to handle the throttle. It would just go numb on me. And if I stood very long or did much walking, I had a lot of pain in my legs and numbness in my feet. I saw the ad in the paper, and I thought, well, I'm gonna call them. Well, I lost the ad, and I couldn't find it again. And finally, there was another ad. I said, that's the guy right there. I want to go see him. My hands don't get as numb. The feet, I may go a day with no pain at all in my feet, and when I do, it's much lighter. And what used to feel like cold water on my legs, I don't really feel that anymore. The pain is very light. In fact, a lot of times I can just ignore it, and it will go away. I mean, sometimes I might be walking, say, through a store, and it'll hit me, and maybe 2 or 3 minutes later it's gone. And I haven't even stopped or done anything. It just goes away. I'm 200% better. You know, it turned out as well or even better than I hoped it would.
Hello, my name is Dr. Elliot Hirshhorn, and I'm the Director of Innovation here at New Life Medical Centers, and this video is called There's Hope for Neuropathy. I want to talk to you today a little bit about neuropathy, what it is, how it's typically treated in the current standard of care in medicine, and how we're different at New Life and how we can help people and have helped hundreds and hundreds of people with neuropathy to not only see improvements in their symptoms long term, but ultimately improvement in quality of life. At New Life, we are different because we don't just treat your symptoms. We ultimately want to address the underlying cause of the problem, and as we do that, your symptoms get better, but if we only focus on the symptoms and just give you a Band-Aid, ultimately, that's no good for you long term. We're also very thorough, so when you come in for your first visit, we spend a lot of time with you because in order to figure out what's the cause of the problem and put the proper treatment plan in place, we actually have to spend the time with you to figure that out. We also take a team approach, so we have different types of providers in our office that have a wide variety of different experiences, and we put our heads together to figure out what's going to be the best possible solution for you ultimately so that you get the best possible results. And then finally, we're educators, and by that, obviously this video is the first step in that, giving you the information you need to know about neuropathy, what it is, how we can help with it. But we believe that those people who are most educated will be able to make the best healthcare decisions. So I want to talk a little bit about why I personally am passionate about helping people with chronic health conditions. I've had a number of family members ultimately that have had chronic health problems but did not get the help that they needed from the standard medical treatment. Starting with my mom, as a kid growing up, she dealt with headaches, which ultimately were diagnosed as migraines. And she went to her doctor, and her doctor said, hey, you've got migraines, and what happened? They wrote a prescription. Prescription helped with the migraine pain and symptoms, but you know, when the medication was done or ran out, the symptoms came back. So ultimately, it wasn't addressing the root cause. And it wasn't until my mom stepped outside of the traditional approach of just medication, she was able to get long-lasting relief from those migraines. My wife, Dr. Carla, who's part of our team at New Life, she was diagnosed with Hodgkin's lymphoma, which is a form of blood cancer. And you know, we went to the oncologist. They said, you know, here's your prescription essentially for chemotherapy, right, and then radiation. But they didn't really give us any direction in regards to how she could best support herself as she went through those treatments. So they didn't say, hey, here's what you should do for your diet and your lifestyle, and here's some things you can do to support your body as you kind of detox from the chemo. We had to make that investment on our own. We went to an integrative cancer doctor halfway across the country, made that investment so that ultimately when she went through the chemo, she did not have the side effects to the extent that would be expected for someone going through that type of treatment. And then my brother. So my brother, all growing up as a kid, he struggled significantly in school because he had difficulty focusing and paying attention, had behavioral issues, so parents took him to the doctor. The doctor said, you know, here's a prescription for Ritalin. He took probably a couple other things as well, and it was helpful to address the symptoms, kind of band-aid the symptoms, so he was able to focus a little bit better in school, and you know, behavior got a little bit better. But once the medication wore off, all those things came back. Why? Because they didn't address the root cause of the problem. And then my Nana, my grandmother, she in 2004 went to her hairdresser, same hairdresser she had gone to for decades, got a haircut, got back in the car, and then got lost coming home. And the reason why is because she was developing dementia. So she went to the doctor said, you have Alzheimer's, and ultimately wrote a prescription for Aricept. Same medication that's being prescribed today as it was 15 years ago, because there's been so little advancements in this disease. And ultimately, in 2012, she died from the Alzheimer's. Going back to my brother, he served in the Air Force and then eventually switched over to the Army. When he went to the Army, he knew that they were going to send him to Iraq, so he went to Iraq. And he did a tour there for a year, and he came back and he really struggled significantly with anxiety and depression. So he went to the VA. VA said, you've got PTSD, he was diagnosed with that. And what they do, they gave him prescriptions. Well, how do you think that worked out? It didn't really work out very well at all. Unfortunately, on August 29th of 2014, my brother took his own life. The symptoms got to the point where he felt like he couldn't handle it anymore. So I lost two family members, my Nana and my brother, because they didn't get the help that they needed for their chronic health condition. They didn't get help that actually addressed the root cause of the problem. So that's why I'm super passionate about helping you to address the root cause of your neuropathy or chronic pain, because I don't want you to end up down the same road that my Nana or my brother did. Okay, some of the neuropathy medications can cause dementia and Alzheimer's. And so ultimately, we want to get you to the point where you're functioning better, you're feeling better, your quality of life is improved, so you don't end up down a road where ultimately it could threaten your independence or potentially end your life. That's why we're passionate about what we do at New Life. So let me ask you a couple questions. Are you experiencing numbness? Are you experiencing any burning pain, maybe to the point where your feet burn so bad you can't sleep at night? Have you experienced any pain in your hands, or back pain, or neck pain? Any type of joint pain anywhere? Maybe you've been diagnosed with neuropathy. If you said yes to any of those things, pain, neuropathy, numbness, tingling, balance problems, then you're watching the right video. Okay, so keep watching. Let me ask you this question. If you said yes to any of those things, how would you like to experience maybe 60 to even possibly 100% improvement in those symptoms, right? Everybody's raising their hand. Yeah, I want to do that. Of course. How has the medication that you've taken so far worked out for you? Is it getting you those levels of improvement? No, because it's not addressing the underlying function. If we can get you a treatment that addresses the underlying function of your joints, your nerves, related to your neuropathy, then we have a potential to see that type of an improvement. So there's two types of pain. There's the pain that's annoying, so that's the paper cut type pain. That goes away after a few minutes, a couple hours, and you don't think about it again. We're talking about the chronic, debilitating pain, the pain that changes your life, the pain that doesn't allow you to walk down to the mailbox and grab the mail, the pain that doesn't allow you to walk around the block with your loved one, the pain that doesn't allow you to get up the bleachers without feeling like you're going to fall over and be able to watch your kids play their soccer game, the pain that doesn't allow you to get it back up off the floor after you're playing with your kids or your grandkids, the pain that diminishes your quality of life to the point that you don't even want to go on vacation in retirement anymore, because you know that you're just going to have to sit on the sidelines and watch everybody else have fun. This is the pain that we can help you with at New Life. So congratulations for watching this video. It is going to be a little bit of your time, but that time is an investment ultimately in your health. Keep an open mind as we move forward. We're going to talk about things that maybe you haven't heard of before, and that's okay. A lot of the treatments that we're going to talk about them in regards to the research that supports them. We're going to give you some patient examples of patients that have improved in their symptoms because we were addressing the root cause of the problem. So we're going to talk about the standard of care, what the typical treatments are for neuropathy. We're going to talk about what could be causing your pain. We're going to talk about the dangers of neuropathy, what neuropathy untreated could lead to. We're going to talk about the proven methods that we use at New Life and how that can benefit you long term. And then we're going to talk about the steps that you can take to actually get on the road to recovery. So let me ask you a question. How much do you think we spend on our healthcare in the United States? It's astounding. $3.2 trillion according to the Center for Medicaid and Medicare Services in 2015, so that obviously has gone up since that time. In spending all that money, we consume 75% of the world's medications, and yet we only have 5% of the world's population. So we spend all this money. and we take all these medications, but we're only 5% of the world's population. And I ask this question when I do this presentation live. I say, how many people think that we are healthy in general as a country? Literally no one has ever raised their hand. People don't believe that this is a healthy country, and yet we spend all this money, we take all this medication, so something is wrong with this system, right? So the question is, where do we rank in relation to the rest of the world in terms of our healthcare? You would think that, hey, we spend all this money, we take all these medications, we must be really healthy, right? Well, we're not really even in the top 10 in terms of health. So where are we exactly? Number 37. We're 37th according to the World Health Organization in 2015 when we rank ourselves with other nations of the world. So what is causing this a critical problem with our healthcare system that we spend a bunch of money on and take a bunch of medications and have procedures for, and yet we're not getting the results? You know, doing the same thing over and over again, expecting different results, that's what Einstein called insanity, right? But we keep doing that every day in this healthcare system. So what's causing this? Well, in the average home, there are two washing machines. You have the clothes washing machine, and then you have the brain washing machine. And that brain washing machine is the television. This is social conditioning. And we, since the late 90s, have been exposed to these pharmaceutical ads that are saying, hey, this medication can help you. Ask your doctor about this or that. They spend about 15 seconds, right, telling you all the great things that are going to happen when you take the medication. Then the rest of the commercial, 45 seconds, telling you all the different things that are going to happen potentially as side effects. And the last one is what? Death. That's not a really good outcome potentially with these medications, but we're being conditioned over time, and we don't even think twice about it now. We know that the end of the commercial is going to be this, that, the other thing, or death, and we just kind of laugh it off because we've become conditioned to it. So the pharmaceutical companies spend almost $5 billion a year with this advertising, and it's to get you to go to your doctor and try to tell your doctor to give you this medication. So what are the most common culprits for advertising for neuropathy? The first one is Neurontin. It's the brand name. The generic name is gabapentin. And did you know that gabapentin is not actually approved to treat neuropathy? It was originally approved to treat seizures. It's an anti-seizure medication. It slows your brain down to the point that you don't feel the pain in your feet, essentially. So that's why it was used to treat neuropathy as well. It doesn't do anything to stop the progression of the disease. All it does is slow the brain down. So if it's slowing the brain down to the point that you don't feel your feet, what do you think it's doing to your cognitive function? Remember my grandmother had Alzheimer's? Well, I don't know that if she took gabapentin, whatever the reason for her Alzheimer's was, ultimately, one of the potential contributing factors for dementia for you could be gabapentin if you're taking it, because it slows your brain down and it could affect your cognitive function. It could lead to memory loss, dementia, maybe even Alzheimer's. Lyrica is approved to treat neuropathy by the FDA, but it's really just a cousin of gabapentin and Neurontin. It's still an anti-seizure medication. It slows down your brain so you don't feel the symptoms. Again, it doesn't stop the progression, and it does increase your risk for dementia long term. So let me ask you this. Do we treat our cars better than we treat our bodies? Anytime I ask this question, everybody laughs and giggles and said, yes, of course we treat our cars better than we treat our bodies. Well, how many of you have ever seen the check engine light come on in your car, right? So what are you supposed to do when this check engine light comes on? You're supposed to go see a professional, right? The professional is going to diagnose the problem. They're going to figure out what's the root cause of the light. And then they're going to say, here's the treatment plan. Here's what we need to do to fix the problem so that you can go on and drive your car. But too often what we do is when we're talking about our bodies anyway, we put a Band-Aid on them, right? So what if we did that in our cars? What if we put duct tape or a Band-Aid over that light? We wouldn't see it anymore, but would that cover the problem? Would that fix the problem? Ultimately, no. So do we have check engine lights in our body? Of course we do. They're called symptoms: pain, numbness, tingling, burning, balance problems. All these things are symptoms or warning signs that there's an underlying problem. And what do? We put a Band-Aid on them and we say, it's not there. I'm ignoring it, blah, blah, blah. And we go on about our lives. And sometimes that's necessary just to get through the day, right? But ultimately, if you do that day after day after day, just putting a Band-Aid on the problem, it's not going to go away. It's just going to get worse. So we have to rip that Band-Aid off, figure out what the root problem is, address the underlying dysfunction, get that function improved, and as the underlying function improves inside, you're going to feel better on the outside, your quality of life is going to get better. And that's what all the treatments that are recommended at New Life are designed to do. Renew how your body's functioning on the inside and restore your quality of life. So what is neuropathy? Let's break that word down. Neuro means nerves, and pathy just means something's wrong with them. So this is damage to or disease that affects the nerves. And it can affect nerves anywhere. It can be nerves in your hands or your feet. It's very common for it to start in the feet. But we've had patients that have had neuropathy in their face as a result of an infection from shingles, for example, that can cause post-herpetic neuropathy or neuralgia. So it really could be anywhere. And it's unfortunately becoming very quickly one of the most common chronic conditions in the United States. About 8% of the population, or 24 million people, have been diagnosed with neuropathy, and millions more likely undiagnosed. It can occur at any age, but it is more common as you get older. And some people are like, well, I'm just getting older. This is what happens when I get older. And no, it's common as you get older, but it's not a normal part of the aging process. Essentially, if you are healthy, you should age, and eventually you just die. And you should be healthy during that process until the very end. But if you're chronically getting worse over time, slowly degenerating, that's a problem. That's not how it's supposed to happen. So it's not normal for your joints to degenerate as you get older. If they were supposed to happen that way, then if we x-rayed your whole body, every joint would have equal degeneration. And you know that you could have a left knee and a right knee, and the left knee is bone on bone, the right knee is fine. How's that happening? Well, it's not because you're getting older that that's degenerating. There's a cause for it. And it's the same with the nerves and neuropathy. There's a reason why they're breaking down. We have to figure out what that reason is, possibly, and address that, but ultimately get that nerve to function and fire more appropriately, and that's how we get long-term improvements in the symptoms. So 30% of all the diagnoses of neuropathy are related to diabetes, and diabetes is a blood sugar problem, and blood sugar dysregulation causes inflammation. Inflammation, that root word, flame, just like a flame can damage a building, inflammation can damage how your body and your brain and your nerves are functioning, and ultimately it damages the structure of the nerves, causes them to malfunction, and then you get all these neuropathy symptoms. So if you have a blood sugar problem, if you have diabetes, we're going to talk to you about how to address that as well. So what are the 7 most common warning signs that you could have neuropathy? Number 1, if you have any type of numbness anywhere, that could be neuropathy. If you have burning pain, cramping, sharp electrical pain, prickling, tingling, feeling of insects crawling on you, feeling of water dripping down your leg, balance problems and or falls, and then if your pain, burning pain for example, is so bad that you can't sleep at night, very likely that you have neuropathy. So what causes this neuropathy to happen? Why do you start to have a degeneration of these nerves and start to have those nerves become dysfunctional? Well, let's think about an everyday common household appliance, like for example, a toaster. A toaster is powered by an electrical cord, and that electrical cord is surrounded by insulation. And that insulation is what helps keep that electrical current flowing appropriately. But if you have a break in the insulation and that electrical cord is frayed, what do you think is going to happen when we try to fire up a toaster with that frayed electrical cord? You're going to get a bad response, a bad outcome. And if you get burnt toast and that's the only problem that you have, then you're in pretty good shape, right? Well, the same thing is happening with your nerves. The nerves are surrounded by a coating, insulation, just like a wire, an electrical wire, and as that coating breaks down, the nerve becomes dysfunctional. So for example, if it's a nerve going to your legs and that coating breaks down, you could feel weird sensations from your legs. So you could first feel numbness, you don't feel anything, then you could feel tingling, you could feel burning, you could feel pain, you could feel the insects crawling on you, water dripping down, and you look down and you don't see any of those things there. You don't have an ice pick in your foot's not on fire, then why do you have those symptoms? It's because the information coming up from your foot through those damaged nerves is becoming distorted and your brain is perceiving it as something that it's not. The only way to fix that is to fix the function of the nerves, and that will stop the bad signals from coming up to your brain. So what are the causes typically of neuropathy? I talked about diabetes being one of the most common causes. anything that decreases circulation to your extremities, your hands or feet, or wherever the neuropathy is, if you don't get blood flow, you're not getting the healing components to allow the nerves to function well or heal if they're damaged. So anything that causes a circulation problem. Any type of toxic exposure. So we have veterans that have been to Vietnam, were exposed to Agent Orange. Now they've got neuropathy as a result of that. My wife, Dr. Carla, did chemotherapy. Chemotherapy will cause neuropathy in most of the patients that do it. So if you or someone you love has done chemotherapy, is going to do chemotherapy, the treatments that we offer really should be done in conjunction with your chemotherapy to help keep the nerve function as stable as possible as you go through that, to help prevent the neuropathy down the road. Any type of back and neck issue, so all of the nerves that go into your hands goes through your neck first. So if you have any type of neck issue, if you have degenerative disc disease, if you have any type of arthritis, if you have bulging discs, degeneration, that is going to cause potentially inflammation or pressure on the nerves, and that could affect the nerves going into the hands. It's the same with the low back as well, so any type of low back issue could also cause neuropathy. If you've had any type of surgery creates scar tissue can create pressure on the nerves, inflammation on the nerves, and that can cause neuropathy as well. Autoimmune disease. So autoimmune disease is when your immune system is attacking you. So in this case, it would be attacking your nerves. That insulation, outer covering of the nerve could be being attacked by your immune system, in which case that could cause neuropathy. Most common example of that would be multiple sclerosis or MS. Any type of an infection. So I talked about shingles earlier. Shingles infection is of the nerve, and that causes severe pain along that nerve. And sometimes, even after the infection is gone, that pain remains because the nerve has been damaged significantly. So we've seen patients that have had post-herpetic neuralgia, as I mentioned. Alcohol abuse. So if you drink excessively, this could damage the function of your nerves. And so some patients, we go in, we talk about their history, they drink a lot. That has to be part of the conversation. In order for us to get long-term relief for you and restore the function, ultimately you have to cut out the things that are causing the problem. In this case, reduce and eliminate alcohol consumption, if that's the cause for you. Liver, kidney, thyroid problems all cause dysfunction of those nerves potentially, and can cause neuropathy. And then there's a big class of medications that can affect your nerves to a significant extent, and that is statin or cholesterol-lowering medication. So the outer covering of the nerve, that insulation part of the nerve that I've been talking about, is made up of fat. The biggest part or component of that fat actually is cholesterol. So if you take a medication that decreases your cholesterol level, it's going to remove cholesterol from that covering. The covering's not going to insulate the nerve, and now you're going to get bad signals going through that nerve to your brain, which could include pain, numbness, tingling, burning, ants crawling on you, water dripping down your leg, balance problems. All those things can develop muscle weakness from statin medications. So I'm not telling you to stop your statin medications. I'm not telling you to stop your gabapentin that we talked about before. You have to have a conversation with whoever prescribed those, obviously, before you discontinue the use of any medications. In particular, for the gabapentin that we talked about earlier, if you stop that cold turkey, that could cause a seizure because of how it works on the brain, even if you've never had a seizure before. So just general disclaimer, don't stop any of your medications, even though we're talking about some of the side effects of them. You have to have a plan to come off of them appropriately under the supervision of whoever prescribed them. And you can do that as we're getting the function restored and you're feeling better. But overall, back to the statin medications, they increase your risk for neuropathy by 1,600%. So part of your plan should be a conversation about what are the other options. And that's obviously going to include some dietary and lifestyle conversations as well. So when we look at the nerves, here's an actual picture of the nerve. There's large ones, meaning they have a very fat outer covering. That myelin sheath is very fat. And then there's small nerves, and the myelin is small, but they have different functions. So the large fiber nerves carry information about where you are in space. It's called proprioception. So just knowing where your feet are and where your hands are, even if your eyes are closed, is carried by these large fibers. And so really that gives your body and your brain information about balance. So when you don't have good function of your large fiber nerves, you can have balance problems, which obviously can lead to falls. 1 in 3 adults over the age of 65 fall each year. 20 to 30% suffer moderate to severe injuries, and 10% of those falls are actually fatal. Falls are the leading cause of injury death over age 65. So if we can do something to improve the function of those nerves so that you have better balance and you have less of a risk for falling, we absolutely have to do that. And the therapies that we do in New Life can absolutely help with those things. The small nerve fibers ultimately are carrying pain and temperature sensation. So when you have differences in temperature, feels hot, feels cold, feels burning, or a lot of pain, that's carried through the small fiber nerves. Now, there's a difference in how you test these nerves too. Those large fiber nerves are tested with the NCV study. So maybe you had that at your neurologist where they put in the needles and they tested the nerves, and maybe they said you didn't have large fiber neuropathy. Even if you don't have large fiber neuropathy, it doesn't mean you don't have small fiber neuropathy. And the gold standard for small fiber neuropathy diagnosis is not that NCV, but it's actually a punch biopsy. It's an epidermal nerve fiber density biopsy of the skin. And what happens is that little piece of skin gets sent off to the lab, and the pathologist looks at it and counts how many nerves are in that sample. And there's a standard for what there should be. And then if you're below that standard, then that's an indication that you have small fiber neuropathy. And so that's the gold standard for the small fiber neuropathy, and that's what we do as part of the diagnostic process at New Life. Ultimately, we want to make sure that your, again, nerves are functioning well, because if they're not, one of the most concerning things is not necessarily the pain, but it's the lack of feeling. So if you can't feel where your feet are and you get into a car to drive and you put your foot on the pedal, but you don't know if it's the gas or the brake, that's not just a problem for you, but that's a problem for everybody around you as well. And in fact, we've had colleagues who help with neuropathy across the country who have had a patient coming to one of their seminars, and the patient actually drove right through the restaurant. Instead of coming through the front door, they came through the window because they put their foot on the gas instead of the brake pedal. And then I've actually had patients tell me they've done the same thing as well. At home, they drove right through the garage, or at the pharmacy, they drove right into the pharmacy wall because they didn't know what pedal their foot was on. And that is a huge problem and a safety issue, not just for them and for you, but for everybody around you as well. So that's the dangers of neuropathy. What are your choices in terms of treatment? Well, you can do nothing. And essentially, making no choice is choosing to do nothing. You can continue to take medications and just band-aid and mask the problem, or you can come to New Life and learn more about what we do and implement the strategies that we utilize to help restore the underlying function of your nerves and improve your quality of life long term. So the treatment protocol that we use is comprehensive. So it's not an easy fix, here's your pill, prescription, and you're on your way. You've tried that already, right? If we want to get improvement long-term of how the nerves are functioning and get you living life again, we have to take the time to actually implement those strategies. So we have regenerative medicine, we have photobiomodulation, we have functional medicine with food and nutrition, and we have combined electrochemical treatment. All of these things do their own individual part to stimulate the healing and repair and regeneration of your nerves so that your symptoms go down and you have an improved quality of life. So I'm going to talk about each one of these in detail and discuss how they help with the nerve function. So regenerative medicine. This is really the science of using living cells, living tissues to regenerate and facilitate the repair of tissues that have been damaged or diseased by genetics or injury or aging. And it works by stimulating your body's own ability to heal itself, and often involves cytokines and growth factors and sometimes stem cells as well. So what are stem cells? Well, there's a little bit of controversy over stem cells that has come from the late 2000s, when there was embryonic stem cells being used, which in my opinion are unethical. We don't use them at New Life, and ultimately they're actually illegal as well. So President Bush outlawed them in the late 2000s. And the interesting thing is, if you dig into the research that they were doing on embryonic stem cells, you'll find that they didn't actually help anything. They weren't therapeutic. They didn't help improve the function of anything. So it's kind of worked out well that, you know, they're unethical. They didn't do anything anyway, so we don't have to worry about using them. So what do we use? We use adult stem cells. And adult stem cells can come from, or basically there's two main types that are available. There's hematopoietic, which are bone marrow, blood-based stem cells, and then there's mesenchymal stem cells. Mesenchymal stem cells are the ones that can actually stimulate your body's ability to regenerate cartilage in a knee, for example, or other joint. It can stimulate the ability to create soft tissue like tendons and ligaments. It can stimulate the healing and repair of nerves, which is obviously appropriate for neuropathy. So where do we get mesenchymal stem cells? There's two basic places that you can get mesenchymal stem cells. You can get them from yourself. That's called autologous. And they can come from fat tissue or bone marrow. So you can do a liposuction procedure and it pulls out the fat, and then you have to spin it down and pull out the stem cells. Or you put a needle into your iliac crest and you pull out the bone marrow and you spin it down and process it and then get the stem cells that way. There's a problem with that, and the number one problem is it's a surgical procedure, and the whole point of what we do at New Life is we're trying to help you avoid surgery. The second problem is that your stem cells are not as potent, which means that they don't work as well as they used to when you were younger. So if we use your stem cells, they're not going to get the same result as if we used regenerative medicine products or stem cells from a younger source. So what younger source can we get that's ethical? That is the umbilical cord tissue. So umbilical cord tissue is normally tossed away as medical waste, but we can harvest that, and it's actually the safest and most effective place to get mesenchymal stem cells. And there's been research that's been done to prove its safety and efficacy in using it for these applications. So once we have the mesenchymal stem cells, what do they potentially do? They can potentially control inflammation. So rather than just shutting off inflammation completely, inflammation is important part of the process, at least short term. It helps to modulate and balance out the inflammation. It does the same thing for the immune system. Instead of just suppressing the immune system with steroids, ultimately it helps to balance the overall function of the immune system so that it still works, but it's not over or underactive. It also helps to reduce scarring. So sometimes people have had surgeries and now there's some scar tissue on the inside, and that scar tissue restricts movement. It can restrict nerve function, creates inflammation. So the regenerative medicine can actually help reduce that scarring on the inside and actually on the outside surface as well. And then finally it helps to stimulate regeneration. So for example, a stem cell can turn into a cartilage cell, a stem cell can turn into a nerve cell, but more typically what happens is that those stem cells help to stimulate your body to create more of those cartilage or nerve cells on their own. So it stimulates your body's ability to heal itself. Dr. Arnold Kaplan, who's one of the foremost researchers in regenerative medicine, he actually coined the term mesenchymal stem cells. He says the vast majority of chronic diseases are due to a lack of or dysfunction of those mesenchymal stem cells, and to a lesser degree other stem cells. So basically what he's saying is that stem cells and the lack of function of them are what causes a lot of these chronic health conditions. And so if we can use new healthy stem cells to stimulate healing and repair, we can see significant improvement likely in chronic conditions like arthritis or neuropathy. So here's an example of using a regenerative medicine for a knee. So you see this knee here is a bone on bone essentially, and this person was recommended to have a joint replacement surgery, full knee replacement, but they wanted to avoid knee replacement. So they got a regenerative medicine injection into the knee, and 8 months later, now you can see it's not bone on bone anymore. So why is that the case? Well, likely what has happened is that the regenerative medicine product helped to stimulate the body's ability to produce more cartilage, and as there's more cartilage, you'll see more space on the x-ray. So this person was able to avoid having a knee replacement. Pain went down, function went up, quality of life got a whole lot better, did not have to do the surgery. So mesenchymal stem cells can also be used for neuropathy. So here's a study that was used that was looking at the neurotherapeutic potential of using Wharton's jelly or umbilical mesenchymal stem cells to help stimulate the healing of the neurons or nerve cells. This is using mesenchymal stem cells from the Wharton's jelly for peripheral nerve repair. This is talking about the stem cells for the treatment of neuropathic pain. So there's a lot of research out there showing how effective mesenchymal stem cells and regenerative medicine can be for healing and repair of nerves. Question that everybody should be asking is it safe? It's extremely safe. With over 100,000 injections from the company that we use, they have had no reported adverse events. And then some more specific studies have been done, and then there was a meta-analysis done on those studies. So meta-analysis is when you combine the information from a bunch of other studies together, you pull all that data together and look at what's happening. So they combined the data from 40 different studies, and they found again in this meta-analysis that there were no adverse events or reactions that happened as a result of using regenerative medicine products. So there is no medication, no surgery that has that extremely safe profile in terms of not having side effects. There's no other treatment or therapy available out there that has the safety profile that regenerative medicine has. When we combine regenerative medicine with some of the other therapies we're going to talk about, we get even better results. So when we combine regenerative medicine with photobiomodulation, or when we combine it with combined electrochemical treatment, it just takes the level of improvement to the next degree. So what is photobiomodulation? Photo meaning light, bio meaning life, and modulate mean change. So how can we use light to change how your body is functioning? So when I do this presentation live, I say, raise your hand if you think light can change how your body is functioning. And I get a few hands that get raised. And then I say, I'm going to prove to you that light can change how your body is functioning by asking you one simple question. How do we make vitamin D? And everybody laughs and says, the sun. Well, that is true. And that sunlight penetrates your skin, stimulates the production of vitamin D. And so that's a great example of light changing how your body functions. The same is true for babies that have jaundice. They don't get a medication, they don't get a surgery, they get put under a lamp that emits a certain type of light that goes through the skin into the liver and helps to break down that bilirubin, and then their jaundice is cured after a couple of days. So light has the potential to stimulate healing and repair and production of different things in your body, and the same is true when we're talking about healing and repair of joints and nerves. And the main way that happens with light therapy is it stimulates the increase of blood flow to the area. So blood flow brings healing elements to the area that we're treating. And so if you shine light therapy on there, we'll get an increase in blood flow. So if you look at the chart, the foot on the left is before light therapy, and you see the bright areas, that's where there's a lot of blood flow. And then after light therapy, you see there's a lot of bright areas. This is a 400% increase in blood flow due to the use of the photobiomodulation or laser therapy.
In 1967, scientists discovered that laser treatments accelerate the body's ability to heal. Delivered at the right frequency, duration of time and location, it was discovered that infrared laser light interacts with tissue at the cellular level, producing a photochemical reaction that results in an increase in the production of ATP and improves cellular function and health. This technique is known alternatively as photobiomodulation, cold laser therapy and low-level light therapy. Photobiomodulation has impacted the scientific community's approach to healing damaged tissue, offering a better, faster, pain-free technique to treat a wide range of medical conditions that are dependent on tissue regeneration. From advanced pain relief to accelerated healing, enhanced range of motion to reduction of inflammation, laser therapy is now a first-choice treatment option for a wide range of ailments including sports injuries, chronic pain conditions, and post-surgery recovery. Many surprising applications for this treatment are now being implemented successfully, including the treatment of a variety of cognitive disorders, including ADHD, Tourette syndrome, concussion, stroke, and traumatic brain injury. Photobiomodulation is often an effective alternative to some surgical procedures and other traditional medical interventions. Because it does not require the use of drugs, it eliminates the possibility of addiction. This system, along with the proper protocol, has shown promising results in many areas of medicine. With no pain and no known side effects, photobiomodulation combines effective treatment with peace of mind.
Here's a research article that talked about the use of photobiomodulation for the treatment of chemotherapy-induced peripheral neuropathy, which is one of the most difficult types of neuropathy to treat, is the chemo-induced ones. And they were using laser therapy photobiomodulation to heal and repair neuropathy from chemo. So if you have just regular old diabetes-induced neuropathy, then the light therapy could be that much more effective for you as well. So what is actually happening with the low-level laser therapy or light therapy or photobiomodulation is it's increasing blood flow, as we talked about. As you increase blood flow, that's going to move the lymphatic system as well, so it decreases inflammation and swelling and edema. It stimulates the body's production of energy, which is critically important for the healing process. And then it does stimulate the process of creating new tissue, so new soft tissue, tendons, ligaments, muscles. It stimulates the production of new bone, so it increases bone growth as well. So we've talked about regenerative medicine, we've talked about photobiomodulation, we've talked about next, functional medicine or food and nutrition. The largest source of inflammation in the American's life is the standard American diet. Standard S, American A, D for diet. It's sad what we eat because it's killing us. So as part of every patient's care plan and recommendations, we're going to talk to you about and counsel you with regard to reducing the inflammation in your diet. If we don't do this, we're going to be limited in what we can do for you. Now, we can see good results if you tell us, hey, I'm 75 years old, I've been eating this way for my entire life and I'm not changing anything. That's totally fine. We can still do the other things for you. You'll still see some improvements, but we could take it to the next level if you're willing to go there with us. So it can be as simple as here's a food list and you try this on your own. We have a nutritionist on staff that can help you and guide you and keep you accountable. And then you can take it to the next level with functional medicine, where we're digging deep into the food and digging deep into other metabolic issues, for example, diabetes or thyroid problems or autoimmune diseases, and really creating a more customized plan for you to address the underlying inflammation and other factors that are causing some issues. And then finally, we have combined electrochemical treatment. And we call this CET for short. Combined electrochemical treatment is designed to treat neuropathy. And kind of how it works is twofold. Number one, we have an electrical cell signaling device that creates a pulsed electrical energy that gently stimulates the nerves and the muscles. And in doing so, it helps to reset the nerve function by electrically activating the neurons or the nerves. It helps to reduce pain by decreasing inflammation. It improves range of motion by re-educating the muscles. So if you have, for example, a knee or other joint involved and we do the electrical cell signaling around that joint, it helps to re-educate those muscles. It's kind of like rehab without all the hard work. And then it increases cellular healing because it also helps to increase blood flow to the area. So this is the electrical cell signaling part, and that gets combined with local injections of an anesthetic and then, more importantly, nutrients. And these nutrients are vitamins and antioxidants that help to provide the building blocks that are needed for the healing and the repair. So just like a mom who is pregnant has to take prenatal vitamins so the baby's brain develops, we have to inject these vitamins and antioxidants and nutrients into your feet, for example, if you have neuropathy in your feet or wherever the neuropathy or the pain is, to provide the nutrients that are needed for that healing and repair. Just like the baby's brain won't develop if they don't have those nutrients, your feet and the neurons and the nerves in your feet won't regenerate properly if we don't give them the nutrients that they need. So this is a critical piece of the puzzle in the treatment paradigm, is this combined electrochemical treatment. You've got the electrical cell signaling with the nutrient injections. Let me address a common question that we have with the electrical cell signaling. People are like, well, isn't this like a TENS unit? I have one of those, collecting dust at home. The difference is, well, let me tell you how they're similar. They're similar in that they both use electricity, and that's where it ends. The differences are that a TENS, first of all, is 1950s technology, number one, and number two, it blocks the pain or numbs the pain. It doesn't fix the underlying dysfunction in the nerves. And then number two, the electrical cell signaling actually stimulates healing and repair of the nerves. So that's the biggest difference. Do you want to just block the pain, basically a Band-Aid, we talked about putting Band-Aids on it, or do you want to heal and repair? And that's what the electrical cell signaling does. So we don't actually recommend that you use a TENS at all for neuropathy. So how effective is combined electrochemical treatment? Patients tell us about 80 to 85% of patients will notice improvement in their symptoms over time. So that's what you tell us, but then objectively doing follow-up testing, we do, for example, the epidermal nerve fiber density biopsies, and I mentioned this earlier in regards to how we test for the small nerve fiber neuropathy. And when we repeat this test, 75% of patients will have at least one new nerve growing in the area that we're treating. Sometimes it takes a little bit longer to get those nerves to grow, but actually more frequently than not, we see even more growth than that. We've seen up to 600% increase in nerve growth with combined electrochemical treatment, and then regenerative medicine on top of that obviously gives us even better results. There's a study done where it compared combined electrochemical treatment up against Lyrica, and the CET decreased pain scores by 54% more than Lyrica, and CET was 62% more effective than Lyrica in reducing the average pain scores by at least 50% without the side effects of numbing your brain. So the CET is very effective and very safe compared to the options of Lyrica or gabapentin, for example. So combined electrochemical treatment is safe, it's effective, it's non-invasive, it has a very low side effect profile, and it's FDA approved to treat all acute and chronic pain. And the best part is it's covered by Medicare and your supplemental insurance policies and private insurances. Most of the major ones cover it as well. Of course, we'll verify all that before you get started, but this is covered by insurance to treat acute and chronic pain. At New Life, we have a multifaceted protocol using regenerative medicine, photobiomodulation, food and nutrition, combined electrochemical therapy to address the underlying function of your joints and your nerves associated with neuropathy, so that as they start to function better, you start to feel better, your quality of life improves, and you get back to doing the things that you want to do long term. So a lot of people come into us, they've been told, well, you just have to live with this, there's nothing else I can do for you, your nerves are damaged, they can't heal. All these things are false in our office. We can do more for you, we can improve your nerve function, and we've demonstrated that on before and after biopsy testing, and maybe you don't have to take the medication. It depends on how much progress we can get for you, but if we can get your nerves functioning better and you're feeling better, then we can talk about reducing possibly your medications as we discussed earlier. So let me give you a couple of patient examples. Number one is a gentleman, 81 years old, has had neuropathy for about a year, including numbness, tingling, cramping, sharp shooting pains, can't sleep well due to the pain. It affects his ability to walk, he's off balance, has fallen a couple of times in the last year. He's tried the gabapentin, little improvement. So he's done 24 sessions of the electrical cell signaling, and he reports improvement in the cramping, less cold feet, his sleep is better. And then when you look at the before and after biopsies, we're seeing a 350% increase in the density of his nerves. So if, let's say, for example, he had 5 nerves in the area before, now he's got 11. In another area, he had 3 nerves, now he has 10.7 nerves. In another area, he had 4 nerves, now he has 5.3. So we are stimulating the regeneration and healing, and we're actually seeing this on follow-up biopsy, which is really amazing because gabapentin and the standard treatments, not only are they not stopping the progression, it's still getting worse. They're not regenerating or healing the underlying nerve function either. This is AS, 73-year-old male, 30-year history of type 2 diabetes, 15 years of progressively worsening neuropathy symptoms, including burning and tingling of both of his feet. It affects his balance, his ability to walk and do stairs. He's tried physical therapy, tried gabapentin, limited improvement. So his treatment plan, he did the regenerative medicine in each foot. He did photobiomodulation therapy and electrical cell signaling with the nutrient injections, also started working on the functional medicine, food and nutrition. He reported improvements in his ability to walk, decreased pain, increased feeling in his feet. And his nerves went from 2 nerves to 8, 3 nerves to 7, 2 nerves to 3. So every area we tested saw improvement and increased nerve density. So he had in some areas up to 400% increase in nerve fiber density, and that was in less than 3 months of therapy. Last example here I'll give you is VA, 85-year-old female. So you see, age is really not a factor. 85-year-old female, neuropathy in both feet for 20 years. So it's been going on a long time, and we're still going to see improvement, as you'll see in a second. Sharpshooting, burning, numbness, tingling, low back pain as well, balance issues, has tried an implanted stimulator, has tried PRP, which is kind of like a regenerative medicine, and some other treatments, and has had no improvement. So she did regenerative medicine, our regenerative medicine product, into each foot. She did it also into the low back because that was a contributing factor. She did the photobiomodulation, laser light therapy, as well as the electrical cell signaling and nutrient injections, and she reports an improved ability to sit for prolonged periods of time without pain, improvement in the pain in her feet as well, and she had a 600% increase in the nerve fiber density on follow-up biopsy. And this demonstrates that when you do the regenerative medicine, in addition to the combined electrochemical treatment, your results go significantly higher. So not everybody who's watching this video is a good candidate, so not everybody should schedule an appointment. But the first criteria to determine if you should schedule an appointment is, do you have any of the symptoms? Numbness, burning pain, cramping, tingling, sharp electrical pain, prickling, balance problems, falls, can't sleep because of pain, diagnosed with arthritis, diagnosed with neuropathy. Any of these things, if they are true, you should consider making an appointment. So how this process works is that, number one, when you come into our office, we're going to do a consultation with you. You'll meet with a case manager or patient advocate. They're going to advocate on your behalf, first by taking a health history, finding out what's going on, and determining if it makes sense for you to go to the next step, which would be to have a medical evaluation with our medical team. They're going to do diagnostic testing. They're going to get a baseline for all of your function in regards to your nerves. And then they may order some additional testing, but ultimately we're gathering information to determine where you're at now so that we can figure out, number one, what treatments are going to be best for you, but we're going to come back to that data and retest it so we can track your progress as you are getting better. At the end of that first visit, the nurse practitioner and medical team is going to go over some of the initial findings. They're going to talk to you about a little bit about the severity of what's going on. They'll talk to you about some of the treatments that are going to be recommended. They'll give you some information to go home with and read that. Then you're going to come back for your full report of findings on your second day, and we're going to meet again with your case manager, patient advocate, who's going to review all of the details of the findings. They're going to talk about the specifics of the treatments, and then they're going to go over any financial and, of course, the time investment involved in you getting better ultimately as well. And then hopefully we'll be able to get started with treatment right away on that second day as well. So these first two visits to our office to find out if you're a good candidate and if we accept you into our program, those are billed to your insurance just like a doctor's visit. So if you have Medicare and a supplement, for example, as long as you've met your deductible in the beginning of the year, then there's usually no out-of-pocket cost for that. If you have an insurance card and it says PCP, $5 or $10, that's what you pay when you come into the office for your visit for your first day and your second day. Then at that second day is when we find out how much do the rest of the visits cost. And again, the combined electrochemical treatments covered by insurance. Some of the other things are not, but we will go over in detail. If you're a candidate for regenerative medicine, how much does that cost? We'll go over all those details with you on that second visit once we know exactly what's going to be most appropriate for you to help you to reach your health goals. So as we move forward and we talk about what we do in our office, I usually like to ask a question like this. So think about this. You probably have a doctor that you see on a somewhat regular basis, right? And you probably have talked to them about the same symptoms that brought you to watching this video, right? So the question I always ask is, well, then why are you watching the video? Well, the answer to that question is because you haven't gotten the results that you're looking for. So if you're looking for something different, obviously, if you've watched the video this far, you know that what we do at New Life is different. And hopefully you know now that we can probably help you in ways that you've never been helped before. If you're not serious about getting better, though, you shouldn't make an appointment because there is an investment to be made. Number one is with time. This did not happen overnight, so it's not going to get better overnight. So if you're not willing to put in some time and effort, it's not going to go very well for you. And obviously there might be a financial investment for things that may not be covered by insurance. Again, we'll verify all that for you and we go over that with you in detail on your second visit. The first two visits are covered by your insurance, just like a regular doctor's office visit, remember. Okay, so one of the things also is that if you're grumpy and you don't think you're ever going to get better, then you're probably not, right? So you have to have a positive attitude. If you're excited about what you've heard through this video and you're ready to go and you want to get better, that's going to propel you forward and help you to achieve those goals. So don't wait, because this is a progressive issue. Remember, this will only get worse over time. So if you say, well, now's not the right time, well, really, when is the right time? Now is the time to get better. Because if you want to do things later in life, you need to be prepared and able to do them. And if we get you better now, then you'll be better prepared and able to do what you want to do long term.
Well, I had a small surgery on my foot and ended up with CRPS, and which is complex regional pain syndrome. And I hear that it's very rare for that. It's nerve damage. And anyway, I ended up with drop foot and neuropathy. I could not walk. It was so painful. And I could not drive, of course. I couldn't really do much of anything. In the beginning, the CRPS pain is so bad that I just laid in the bed and cried and sometimes yelled. And you know, it was a pretty fierce pain. They say that CRPS, on the level of pain, there's birth pain, there is cancer pain, and then there is CRPS pain. I went to a pain management, and they did some injections into my back, and for the immediate pain that helped. And after a few months, that pain got better, but the neuropathy and the drop foot did not go away, and it was still very limiting. I can't walk without a brace, and I couldn't, before I came here, I couldn't drive. I couldn't walk across the room barefoot without severe pain. I am able to walk a lot better, and my balance seems some better, and I can drive. So that was a huge step right there. I can drive. This was something that really gave me independence back, and that's a wonderful thing. You have to depend on people anyway the older you get and all. So being able to drive was great. Everybody here is very professional. Everyone here is super friendly. You walk in the door and Sonia greets you and Carla greets you, and they're just so happy to see you, you know, and then I come back, and Constance and Jim, they are just so caring, and they want to know exactly if everything feels okay, if you're getting too much of the stuff or not enough of the stuff, and they're just very, very nice, very caring. So everybody was very open, very friendly, and gave me complete information about what y'all were about. And that seemed like, you know, my other doctors weren't doing anything else for me. In fact, you know, I didn't even hear from them anymore. And so I said, this sounds good. I know a friend that's doing it. I don't know exactly what her status is for her, but I'm definitely going to give it a try. Everything seemed very professional here also. I would say, give it a try. There's a lot of things out there that you don't know about. And there are new things out there that you don't necessarily find from your regular doctors and the regular medical field or whatever, but there are things out there that are new, and they are making a difference. And give it a try, you know, won't hurt you.
I was having back problems. Then my neuropathy was the main thing that has been giving me problems. I'd go to sleep at night, and about an hour and a half or 2 hours later, I'd wake up with the burning needle pen stuff in my feet. I ended up having the stem cells done, and my back does not hurt anymore. I have had the synectis. That really has kept my feet from hurting. I've been able to stand longer. I've been able to walk further. And when I go on my trips, I get to go where everybody else goes rather than sit on the sideline and watch. The thing I could do most, I think, is sleep. Not have to wake up every few minutes or so. I am most pleased with everything that I have experienced since being here. Y'all have made me feel like family, and everybody treats me so nicely.
Aren't those stories just so exciting? Wouldn't it be awesome if you had a story just like that for yourself? That's what makes it so exciting to come into the office every day at New Life, is just being a small part of creating stories like that that are really changing people's lives every day. So again, the next step, if you don't have a consultation scheduled already, is to go ahead and schedule that consultation. We will get you scheduled for an opportunity to meet with a case manager. We'll go over your health history, and then we will have you meet with the medical team. We'll get your evaluation done. We'll bring you back on day 2. On that second day, remember, you have to bring whoever helps you to make healthcare and financial decisions. We're going to go over a lot, and they can help you to make that decision to get started on really the road to recovery and on your journey to a new life. So I want to thank you so much for taking the time to watch this video. I hope you learned a lot, and we look forward really to meeting you in the office and helping you on your road to recovery, on your journey to a new life, because despite what you've been told, there is hope for neuropathy.